Hi, my name is Kelsey. I have EDS and I've had a fusion for my CCI. With craniocervical instability, your C1, this bone right here, which is responsible for a lot of your side-to-side head movement, becomes unstable due to the lengthening or damage to the ligaments between these two structures. Now, because your first vertebrae, your C1, is so close to the bottom of your skull and a lot of very important arteries, blood vessels, and the base of your brain, any injury here can be incredibly serious. And at its worst, you're at risk for internal decapitation. A good physical therapist is not going to want you to continue doing activities that are leading you to be blacking out. And I actually had a physical therapist who was not well versed in Ehlers-Danlos syndrome, where I did black out during PT, and they thought that I was just weak. Like, yeah, I am weak. My internal structures are very weak, and they're injured. Another thing that can happen with C1 instability is that your odontoid process can be pushed posterior and actually interrupt signals with your spinal cord. If you think about a spinal cord injury, when you injure something at a higher level, everything below that level is at risk. If you have Chiari malformation where the base of the brain is sinking down into the spinal column, you can imagine that that's also going to cause problems with your autonomic nervous system, which is what happened to me. I had Chiari and then I had CCI and I had a retroflexed odontoid process like this picture here. And I actually had brainstem compression, which led to all kinds of brainstem seizures and loss of the ability to talk called aphasia. I had transient paralysis, and it was a very concerning injury. These were my scans prior to my fusion. You can see that my odontoid process is just impinging my spinal cord a little bit. You can also see that my Chiari is coming down a little bit below the skull, and that was getting compressed. I also had some adhesions or scar tissue around the base of my brainstem, and so I was not getting CSF flow or blood flow to my brain. It might be a little hard to see, but there's a lot more room in this after photo around the base of my cerebellum, and I had a posterior fossa decompression and laminectomy to make a lot more room there, as well as a fusion which straightened up that part of my spine.